Welcome back. The number of cases of the flu in Hawaii are on the rise, and we're only approaching the middle of our flu season. Let's send it over to Bridget, who's with our medical expert. Bridget?
Thanks, Kathy. Dr. James Ireland is with us tonight. Always a pleasure to have you here in the studio. So, Doc, what are the clinics across the state seeing?
Well, in my own clinic last week, I saw way more cases than I've seen in the previous month. One day, four patients, the next day, 2 patients. 2 had to be hospitalized, so serious flu. But what I talked to my friends in the ERs and the urgent cares, they're seeing just over the last week and a half, more cases. Family members coming in where multiple are sick, and they're swabbing them, and they are coming out positive, mostly for influenza A.
So that's a particular strain you're seeing a lot of lately here in Hawaii.
That's right, and usually there's different strains of A, different strains of B, but what seems to be going around, and we get this data from the health department, is about 95% are influenza A, maybe about 5% or a little more is influenza B, which generally can be a milder flu.
We have had actually a few producers here come down with the flu. Tell us about the ages that you're seeing, the age range of people getting the flu here.
So in my clinic I see adults, so anywhere from 20s and 30s all the way up. I think the oldest patient was in their late 60s. But the people coming in the ERs or the urgent cares are all ages, from toddlers to very elderly. So really it's the spectrum. But the concern is the extremes of ages, the very young, the very older patients, and people with other medical conditions like diabetes, or if their immune system is suppressed for some reason, they can potentially get the flu worse and become hospitalized.
When you say worse, what do you mean?
Well, when most people get the flu, it's a drag, you've got a fever, you don't feel well, a couple days off and you're back to normal. But in the more severe cases, people can get an actual pneumonia where they can't breathe, the secretions impair the ability of the lungs to get oxygen distributed to the body. They have to be put on oxygen bronchodilators, and in the worst case even be put on a ventilator or breathing machine, and that's the most severe forms of the flu where they actually end up in the ICU, and people can pass away from that, unfortunately.
All right, so everybody, I think it's safe to say, everyone knows what the flu is, but for those who haven't caught it, can you remind us about the symptoms?
Well, generally people will have a fever. They'll also have body aches. They may have a sore throat and a cough. But it's impossible or difficult even for a physician to sometimes tell the difference between like a bacterial pneumonia and a viral flu or influenza. And we treat them different. Bacterial pneumonias get antibiotics, whereas the flu, if anything, gets an antiviral like Tamiflu or the new treatment, Xofluza. And so really it's good to get in to see your doctor, not necessarily in an emergency room. If you can't get in to see your private physician or practitioner, urgent cares are great for this. They can swab for the flu. They can tell you usually within 15 minutes if you have it, and then they can offer the treatment right there.
So one last question. You mentioned something new, Xofluza. Can you talk to us a little bit more about this treatment?
Well, Tamiflu has been the standard for flu for the last number of years. It doesn't cure it, but it reduces the days of symptoms, and Xofluza is similar. Tamiflu you generally take for 5 days. Xofluza is just for 1 day, and it reduces the symptoms by a day or 2. And so it can make a severe flu less severe is the idea.
And Doc, real quick, when will we see the tail end of the flu season? Or the end, rather?
Hard to say. Ideally and typically by May, flu season is considered over, but Hawaii has flu all year, and people come here from all over the world, and unfortunately they sometimes bring their germs with them. And so we see flu all year, but there's spikes and peaks in the quote flu season, which is right now.
Great information. Thank you, Doc.
Thank you.
Kathy, back to you.